Well, as promised, more from the Chief Minister. We haven't caught up with you for some time. You've changed minister since...
Yeah.
That was... I mean, the rumours have been going around, and I put it to her when I interviewed her last year, and she was very definite she didn't want to go anywhere, And then the papers write up that you go to see her in hospital and with some flowers, so then sack her. Well, she resigned, but it was a...
Yeah, no.
She's claimed it's now... I have to go, didn't I?
Yeah, I was disappointed with that because, you know, you've got a colleague who you've worked with for 6 years, who's in hospital, seriously ill, and you know, to me, the decent thing to do, you do it with anyone, is to take a bouquet of flowers up to wish them well, and see that their health is on the improvement. So the conversations where we had to have a full and frank conversation didn't happen for a number of weeks after that situation. Right. I mean, just because you've got to make a tough decision doesn't mean to say that your moral standards of caring about that person go out the window. But you gave her the chance to fall on a sword, presumably, and that's what technically it was a resignation, but you were going to sack her. Yeah. And this has been going on for some time, so you put it off because she was in hospital. I mean, you'd done this some months ago? You're not. I wasn't going to rock into, So yeah, it was unfortunate. It clearly hadn't been working behind the scenes for a while, and sadly, Mrs. Beecroft had been ill for a while, and it's a situation that I didn't take any pleasure from having to do.
Well, it's your first moving around, and it's never easy, I'm sure. But the fact is, you didn't have a full rejiggle. I mean, the ministers could have all had a little bit of moving departments.
Well, they'd only been in the job for 16 months. They're learning the ropes and the problems in those departments.
But that's the biggest one. You know yourself. You had it.
Yeah, but I went straight in as a backbencher myself, so it can be done. I mean, David Ashford is. I mean, the one thing I had an incredible advantage maybe over previous administrations is that we had a phenomenally good depth of new backbencher that were capable of doing a good job as a minister. So there was 2 or 3 that could have come up at the time. So David Ashford, he's hard working, he's got it on capability, the questions he's asked this administration, he's tied some of us up in knots from time to time.
It's a poison chalice though, isn't it? Well, I mean, everyone's used that term very flippantly, but it's a difficult... This is a super tanker changing direction, this thing.
Yeah, it's not a poison challenge, but it's a really, really tough job. Yeah. I used to go home and my wife would have 7 or 8 phone calls I'd have to make that night from people that had contacted at home. It's a very emotive job. It spends 263 million gross, 209 million net of taxpayers' money.
These decisions to stop inconstant pads and all these other things that were coming through, is that stuff you were uncomfortable with? I mean, do you see those as tinkering around the edges and you want to see some massive changes?
Well, I think... I don't want to go into the detail of it. Mrs. Beecroft worked blooming hard during her period, but it clearly wasn't working. 2 members had resigned from that department.
And as well documented, the CEO wasn't... there'd been an interesting interest, but they said it was patched over, but that can't probably help.
It was a department that... there was always problems. When you've got 2 members that have resigned and other people not happy, you have to make a decision. And, I thanked Mrs. Beecroft for her hard work because she had worked hard in the department. It wasn't working and we had to move on.
How long do you give David before he's got to start making some major changes? And
well, he's the Minister for Health and Social Care. He's hit the ground running and he'll be working on coming up with policies to take it forward. But we've got Tynwald's support for a review on how we fund the health and social care service going forward in discussions with the people of the Isle of Man. So let's see what we get out of that.
And back to my thing about having a rejig, you didn't think that anybody else needs to go or freshen up a department?
I think all the department ministers are doing a damn good job at the moment, and to move them so soon into going there would have meant you'd have had 2 departments with ministers new to those departments. So
have they everyone got your confidence as well when you go into Comin? And you're having an easy time or are you challenging time?
It's a very hard-working, content Comin. Everyone.
Content?
Well, yeah, I think we have our problems. We have frank discussions. If one minister's bringing in a policy that maybe others aren't too keen with, we'll thrash it around and have a discussion. But it's a hard-working, happy council of ministers, and that's the only way. I think I know my good friend Chris Robertshaw keeps on saying single legal entity all the time. To me, the best way forward for any government is having people working together for the greater good rather than the sniping. And everyone gets on well in the Council of Ministers. They're there for the people of the Isle of Man, and egos and score settling isn't coming into it.
Okay.
And that's got to be a really good thing.
We'll leave this one here, but I want to do something on Vision 9 yet and some other things. So, as I say, we're having a whole day of talking to you.
Well,
and
unlimited.
unedited.
Yeah.